EJ, why don't you put your hand around him? No? You're doing a very good job. This is very good.
Just a few months ago, this would not have been possible.
When I saw anyone black, I wouldn't be myself. I'd be all scared and impulsive, and I'd be like, is that gonna jump on me?
John McDonald's mom said his anxiety got so bad her son would cross the street in order to avoid anyone black.
My mom banged a black guy in front of my dad, and my dad's white, and he got really pissed off because he didn't know about it before, and he made her come way harder than he has ever made my mom come.
She told you that?
She said that specifically in the video they were shooting.
Oh.
They made a video about it, a porn, I guess they're called. And
addressed to you?
Yeah, it's in my will, so it's like mine.
Interesting. So she's dead?
No, my mom's dead, and the last thing she said was that she didn't want me to be racist anymore.
Last wish?
Experts say certain stressors can cause fear, anxiety, or obsessive-compulsive behaviors in a child or teen. Therapist Garrison Franklin is one of the few racial tension experts that was reached out to by psychiatrist Kristen Adams for conducting this therapy. Clients have parents who tend to help their children avoid any stimuli, triggering distress, creating a habit of avoiding fears rather than overcoming them.
You'll hear these suggestions from parents such as, let's cross the street, let's move away from it, let's, not get yourself upset about this black guy fucking your wife or being honestly observant. Let's vote to make black people have difficult lives in punishing environments.
So he's leading a study investigating whether exposure therapy can help people with emotional disorders.
It's a child's first impulse to avoid things provoking that sense of distress.
Therapist Garrison Franklin from Tacoma, Washington, has partnered with Professor Adams leading an exposure therapy study for clients of all ages on their feelings with uncomfort around black people.
You see, this is all about moving toward and experiencing new emotions rather than avoiding them.
For an accurate approach to conduct this experiment, John met with therapist Garrison Franklin to talk about the origins of fear. For John, this would involve gradually introducing him to pictures of black people, like our volunteer, E.J. Watson. Then John would be asked to notice his sensory intake for any shock, anxiety, and anger. Afterwards, he would be asked to positively or negatively affirm his handling of the stimuli. When the emotional intake was improved, Franklin would continue. Each session had its own challenges, which came about from an unexpected introduction to newer black people in photos. But in this case, there was progress. More advanced sessions consisted of a greater level of stimuli intake to see if John was able to stay relaxed before an official meeting with the real EJ. Slowly, they came into the room together under a touch therapy exercise conducted by Franklin.
Would you be okay with EJ putting his left hand right there, just on your left shoulder, just like buddies, friends?
Yes.
Yes. See,
Yes.
we talked about this. Not EJ, not too fast. You're gonna spook him. Nice and slow.
Just a hand on my shoulder.
Just a hand on your shoulder. It'll be okay. Loosen. Okay. Relax. Breathe. What are we talking about? Breathe. Not weirdly. Breathe like. Okay. I'm gonna write that down. Fixed breath. Okay. His nostrils look. Are you breathing? Or are you hissing?
Yeah.
Say these words. Just as good as a white guy.
Just as good as a white guy.
After 8 sessions, this was the result. John was able to play with EJ without any fear, anxiety, or racially charged impulses, as predicted by psychiatrist Adams. After careful consideration, psychiatrist Kristen Adams advised therapist Franklin to continue supervising interactions of playing between John and EJ until nearly all the racism was gone. Upon completion, John was no longer racist and is now only bad at connecting with people.
So he's guided me through college applications. He's turned me on to different mixed drinks that I didn't know before, which I really like now. He's also gone through my headshots with me to see which shows the most authentic me, because I'm trying to be an actor and it's my dream. Am I getting paid for this, by the way? Is the black guy getting paid for this? Because if he's getting paid for this, I definitely want to get paid for this.
Though funded by Gooshers, the study was unpaid, with the exception of the black volunteers. Doctors say that parents can actually practice this exposure therapy at home, but advises you to be very positive and patient with your child. Gooshers is also training more therapists about this form of cognitive behavioral therapy. This form is a safe and natural process designed to reduce anxiety. For Health, Wealth, and Mental State, I'm Laura Jennings.